Hi, I'm Dr. Felice Gersh, your integrative OBGYN doctor, here to talk with you about another topic I hope you'll find of interest. But first, for those of you who are new to my show, let me just briefly introduce myself. So, as I mentioned, I am an OBGYN, but I am board certified in more than just that. I'm also board certified in the new field of integrative medicine. I did a 2-year fellowship at the University of Arizona School of Medicine, and I have never looked back. So, in my practice, I incorporate all of the evidence-based therapies, starting with the most safe, the least dangerous, and of course, I look for efficacy. So I incorporate a larger therapeutic toolbox than the average physician because I have a great deal of education in nutrition, stress management, lifestyle medicine, environmental toxicants, biological toxins, and I use all of this knowledge to formulate a unique personalized plan for each of my patients so that each one can have, hopefully, an optimized health and a wonderful life. Well, not everyone right now is actually having a wonderful life because there is a condition that has not gotten anywhere near the amount of attention that it deserves. It goes by a couple of different names. One is long haul, sometimes just long COVID. Yes, we're talking about those individuals, of which there are likely thousands and thousands now in the United States and no doubt around the world, who, after having an infection with the SARS-CoV-2 coronavirus, actually continue to have long-term, really at times disabling symptoms. So let's go into a little bit more depth on this. Well, who is likely to experience, we'll call it long COVID? Well, it turns out there has been some dispute about this, but as more data emerges, it actually appears to be predominantly younger and healthy women. But be aware, it can occur in any age and in any gender. So there are certainly older people who are experiencing long COVID symptoms. Initially, it was thought that those who had the most severe experiences, the most severe infections with COVID, were the ones who were most likely to have the long COVID problems. Well, they certainly can have long COVID issues, but it's emerging now that particularly these young, generally healthy women are the ones who are really, by and large, becoming the dominant group that's affected by long COVID. Now, let's think about this. Like, why would anyone have long COVID? Well, there are many viruses and other infectious agents that can inhabit our bodies in a chronic fashion. Let's talk about a few. Well, that you're, I'm sure, familiar with. Let's mention viral hepatitis. So there's hepatitis B and hepatitis C are the ones that are known to cause long-term chronic infections. So let's say someone gets infected with hepatitis B. What would the outcome be? Well, for most individuals, they would have the infection, their immune system would control it, and they would simply recover and get on with their lives. There's another group that would have fulminant hepatitis. They would have an explosive infection and actually die. And then there's another group that seems to recover or may not even have had any symptoms. And yet this virus makes a home in the liver, creating a low-grade chronic infection and inflammation that can go down the path to liver cirrhosis, complete liver failure, and death unless someone gets a liver transplant. And we know there are other viruses that can create a long-term effect and stay in the body indefinitely. How about herpes simplex viruses? You've all heard of genital herpes. Well, some people get infected with herpes simplex 2, and they have no symptoms. In fact, about 70% will have no symptoms. Others will have a really terrible outbreak, a terrible infection where they can't they just can't stand the pain. They can't void. I have patients who've had to practically live in a bathtub. Nowadays, of course, we have valcyclovir, we have medications that can help. And some people who get infected with herpes simplex, they recover immediately and they just don't have any more outbreaks, but others have recurrent outbreaks on a regular basis. And then we have mononucleosis Epstein-Barr, which is also in the herpes family, that for some people can cause something that's actually quite similar to long COVID, which we know as chronic fatigue syndrome and also as a long-term encephalopathy. So that's involving the brain. And now we know that people can be infected with viruses and have long-term infectious type sequela. Now, we never knew, what is going on with these cases? Well, we know in the case of hepatitis that the virus is still present and continuing to infect in a low-grade chronic manner. Well, this may be, we don't have proof yet, but this may be what is happening in those with long COVID. So what's happening is this virus, the coronavirus, is actually making a home in epithelial surfaces. So what do I mean by that? For example, within the nasal passages or the sinuses, in the lungs, it can be possibly even in blood vessels, but most commonly, it's probably in the intestinal tract, what we call the gut. Well, we know that we can have COVID infecting many different organs of the body because we know that the pathway in through the alternate receptor involving the spike protein, this new alternative type of an entry where they take the ACE2, which is an enzyme on the surface of cells, and they convert it into a passageway, into an entrance. So it becomes actually a tool used by the virus to gain entry into the cells. And ACE2 now formed into a newfangled receptor, that's a modification of what it normally would be doing, is present in many tissues of the body. That's why it's not a simple, as we once thought in the very beginning, that it was strictly a pulmonary, a lung problem. No, this virus can infect many different organs and in the brain as well. I hate to tell you, but actually it can cause an infection in the brain, as can many other viruses get into the brain, creating chronic infections. So what happens if you get infected with the coronavirus, you get COVID, and it actually makes a home in your lining cells of your intestines, okay? And it just creates a low-level chronic infection. Well, it's going to put out little particles of the virus, and it may be low-level, continued to be infectious. We actually don't know this. We don't know. So I don't want to scare people, but we just truly don't know for sure. We know that in China now, they've created a COVID test. What are they doing? Anal swabbing, because they are now recognizing that there are cases where the infection is not so much in the nasal passages, so that swabbing the back of the throat or getting saliva or getting deep into the nasal passages, that may not tell you if this person is actually infected or not, because the infection may reside elsewhere, like in the gut. That's why in China now, they have a test using an anal swab. That seems actually like a very good idea. It may not seem appealing, but you know what? We really need to know, we need to learn what is going on with long COVID so that we can help people to get better. So what are some of the symptoms with long COVID? Well, they can include a whole myriad group of symptoms. Most commonly, severe fatigue, like people who get chronic fatigue syndrome, which in many cases is related to Epstein-Barr virus infections, but not always. I'm sure it's due to a variety of viruses and probably other causes as well. But in terms of long COVID, it turns out that fatigue is pretty overwhelming. And along with that comes brain fog. Just think how awful it is. There have actually been people who have said the following: I I was totally a capable person. I run a company. I'm highly responsible. I'm a professional. But I'm now driving a car, and this is many weeks or even months after I had my COVID infection. And I'm driving the car, and as I'm driving, it suddenly dawns on me, I'm the driver. It's like I forgot I was the one driving the car. Like I thought I was a passenger. Or they get to a four-way stop, and they think, I have no idea when it's my turn. I don't know what to do. These are people who were incredibly competent, and now look at what they're facing. They don't have energy. They used to climb mountains. Now they walk up a flight of stairs and they need to rest. They have to take naps in the day, every day, because they can't get through an entire day without getting off their feet and going to sleep. Yet at night, they often have sleep disturbance. They feel wired and tired. That leads to anxiety and depression. So mood disorders are also common in people who have long COVID. What else? They may have myalgias. That's muscle pain, particularly low back pain, but it could be like fibromyalgia. All the muscles may be sore. Joint pains are not uncommon as well. And they may also have GI symptoms, kind of like irritable bowel syndrome, where they may have intermittent diarrhea or constipation or one or the other, but their gut just doesn't feel right. They have more indigestion. They may have bloating or gas or acid reflux. They know that their GI tract isn't what it once was. Things are just off. And it is debilitating. I can tell you, I have patients now, young women, previously healthy, no risk factors, and they're truly suffering. They're not able to go back to work full time, and they feel completely different. They feel like they've been transformed into disabled people who can't focus, or they're always tired, and they just feel off. They just don't feel well. That overall sense of, I don't feel good. Sometimes they even have like a low grade fever. I mean, very low grade, but it's not the temperature they used to have. It's like 1 degree higher, even though it may not even qualify as a full-fledged fever. So if this is, and we don't know this, I want you to know that the theory that this is a low-grade chronic infection has not actually been proven, but it's one of the theories, and it's the one that, at this moment anyway, that I am embracing as the most probable etiology of long COVID. Now, why women? I mentioned that it can happen in any age demographic, males or females, but they're finding that young women seem to be the most afflicted. Well, it's actually the same group in general. Remember, we're just talking about generalities or exceptions, and any gender, like I said, or age can be involved. But like, for example, chronic fatigue syndrome and fibromyalgia are predominantly related to being young, healthy women. So let's think what happens when you have a chronic infection. Well, if you're continuing to make viral particles or the whole virus or pieces of the virus, so your immune system is perpetually being exposed to virus. So what does your immune system do? What it's designed to do, make antibodies. So now you have a system going on in your body where you're making all of this low grade but continuous particles of whole or pieces of the COVID virus. So your immune system is now making antibodies against it, but all the time. Now it turns out, and many very renowned immunologists have already written and published papers on this topic, that the protein antigens of the coronavirus have tremendous similarities with human antigens and proteins. In other words, our cells, our DNA, our RNA, our proteins in cells look like those of the coronavirus. Now, maybe you didn't know this, but we are like giant conglomerates of viruses and bacteria. In fact, if you think of a virus or a bacteria, a single one, as a Lego, then we are like Legoland on steroids. We are like these amazing constructions of these building blocks, viruses and bacteria. Now, they've been modified, but we are descendants. So our proteins and our DNA and our RNA is very similar to our ancestors, bacteria and viruses. So when our immune system is making antibodies trying to disable and overrun and control the COVID, these virus particles that are being made during this chronic low-grade infection, these antibodies can cross-react with our own tissues, setting up autoimmunity. That is what autoimmunity is. And most autoimmunity is actually, we now know, related to chronic infections. And that can also link to environmental toxicants, which can modify proteins and create leaky guts and so on. So we won't go into all of that. We can talk more about autoimmunity in another show. But just for now, know that this is the basis for how autoimmunity develops, that you can have a chronic low-grade infection where you have perpetual exposure of your immune system to these viruses or bacteria, in this case, the COVID, the coronavirus. So our body makes antibodies which then cross-react and attack our own body tissues. We call that molecular mimicry. So now you have sort of a low-grade state of autoimmunity. We know that 80% of autoimmune diseases are in females, and many of them are in young, otherwise healthy females. So we also know that having an impaired gut barrier, or what we know as leaky gut, is incredibly related to the development of autoimmune disease. So this is why there is now research ongoing, early phase 1 trials using biologics, like these immune modulators that are used in autoimmune diseases to see if they will improve the symptoms and the status of people with long COVID. Now, I am all in favor of symptom control and symptom reduction, but what is my main ultimate goal? Resolution and ultimate cure. So what do I think we can do for people with long COVID? Well, maybe giving the vaccine one dose. In fact, now this is a mixed bag. We don't have consistent data, and really this is very preliminary. But there are reports that in some women who got one dose of the Pfizer vaccine, that's the messenger RNA vaccine, their symptoms resolved. Now, that's not universal, so I want to make sure, but what on earth is universal when it comes to a cure? There's nothing that is 100% curative of anything. But if this has a significant cure rate, how fabulous. Now, how could that help? Well, when you use the messenger RNA, you are creating some spike protein and you're activating then the immune system to go after it. So maybe what's happening is that by giving this sudden spurt, like this big like explosion of the spike protein, instead of this low-grade chronic level that's being produced by this chronic low-grade infection, you're getting this big spike and the immune system is being highly activated and actually curing the individual. That is really exciting. So maybe, just maybe, the ultimate cure for long COVID will be a messenger RNA vaccine. Or maybe the Johnson & Johnson would work too. We just have no data on that one yet. But maybe instead of trying to suppress the immune system, which is what immune modulators do, they're trying to suppress the immune system so you don't get the symptoms of low-grade fever, fatigue, and aches and pains and so on. Because remember, those are signs of systemic inflammation. Inflammation means the immune system is active and doing something. That's how you get inflammation. pain always involves inflammation. So this is a chronic state of inflammation when you have long COVID, probably induced by a long-term chronic infection with COVID, mostly in the gut, but it can be elsewhere as well, in any mucosal epithelial lining cell. Unfortunately, it could also include, like I mentioned, blood vessels or in the brain, so we really want to get on this. The faster we treat it, the better off the outcome will be. So people with long COVID should really think about, as soon as they're eligible or working with their physician, to get a note saying that they are high risk, to get the vaccine and see how you do. What's the downside? Well, there have been a couple of people who have, maybe a couple, I don't really have an exact number, but there have been some reports that some people felt like their symptoms were exacerbated. Now, maybe that's because their immune system was so revved up, but maybe that's not a bad thing. Maybe it's like how people respond after the second shot when they get the second dose of the Moderna or the Pfizer vaccine, and then they feel really sick for a day. I can tell you, I know people that happened to. So maybe this short-term exacerbation means that their immune system is finally getting control of the situation. And as I mentioned, that women make up 80% of all those who suffer from autoimmunity. That's because women's immune systems are so different from male immune systems, and females are much more likely to develop autoimmune diseases. But remember, it's 80%. It's not 100%. And most autoimmune diseases start in younger women, but not all. Rheumatoid arthritis is far more common in older women. So these are generalizations. These are not mandates or, all-encompassing. So the bottom line is that long COVID is really common. How common is it? Well, there's some data that is now showing that when it comes to long COVID in women, about 30% of those who have light cases, even asymptomatic cases of COVID, are developing long COVID. Can you imagine 30% of people, predominantly young women, who have had COVID infections, some of them with no symptoms, are developing these long-term sequelae, these symptoms that are totally devastating. Now, we don't know the real data because we don't know all the women who've had no symptoms and had COVID. So I'm sure if we actually tested the entire population, the percentage would be much lower. And there's some studies that are saying that the percentage is in fact much lower. But it's a mixture of data because we don't have enough collection of data on long COVID. Most of the emphasis, and not wrongly, has been on the most severe cases, hospitalized cases, and death. Well, totally that makes sense. But it's time now to look at the long COVID sufferers, get more data, and get on it. And let all of these people, the predominantly young, healthy, previously healthy women, know that we care about them, that we're looking for solutions, and that hopefully we have one already here. We just need more testing and more data. So thank you again for joining me today, and I look forward to many, many more episodes. Please leave your comments. Please tell your friends about this show, and know that I also am a practicing doctor. That's what I mostly do. My office is in Irvine, California. I have a brick and mortar practice. I can also do some telemedicine. I'm here to help. That's my mission. Take care. Stay safe. Bye.